Fabulous. So good morning, everybody. And again, good evening for those of you who are joining us from India. I'm going to keep my remarks relatively short. I'm going to speak for about 7, 8 minutes or so. And I want to talk a bit about what is happening in India, the crisis that it is, why I'm so pleased to see the Biden administration making what I think are really important moves towards helping India. And then I'm going to also spend a few minutes talking about the state of the pandemic in the United States. Obviously, there's lots of issues I will not get a chance to cover in my remarks, and I'm happy to get into them in the question. So India really is in a very difficult moment in this pandemic. India has been seeing 3 to 350,000 new infections a day. That is a gross underestimate of the true number of infections happening. There are many ways that we can arrive at the fact that it's a gross underestimate. One of the biggest is that the test positivity rate in India is very high. It's close to 20% nationally. There are parts of India where that's 30 or 40%. And as a way to understand it, when test positivity rates start getting much above 3 or 5%, it begins to give you evidence that you're missing a large chunk of cases. Once you get to 20%, you're probably missing 2/3, 3/4 of all cases that are out there. So the true infection numbers in India right now may easily be above 1 million infections a day. The official number suggests about 2,500 to 3,000 deaths a day. If you know India and you know about the death surveillance information, what's happening on the front lines, that number is also clearly an underestimate. It's hard to know exactly what the true number of deaths is, but again, I think the best estimates out there are that it's probably maybe as much as 5 times that. So easily could be 10 to 15,000 deaths a day. Let me talk a little bit about what happened, how India got here. Basically, in my mind, there are 3 or 4 factors that have contributed to India being in the situation that it's in. One is a very substantial relaxation of all public health safeguards. So over the last few months, most things in India opened up. You saw kind of pretty repeatedly large political rallies, sporting events. The Kumbh Mela, which happened in Haridwar recently, is a major festival gathering of people from all around India who come to a city. Millions of people came, and none of that is doable and safe to do in a pandemic. And yet that is what we saw happening, is this huge relaxation. I think that was a major contributor. We've seen substantial declines in mask wearing across India, and vaccinations have been going relatively slowly. About 8 to 10% of the Indian population has gotten at least 1 shot. Nowhere near enough to do much in terms of blunting large outbreaks. And then last but not least are the variants, and specifically B.1.1.7, which is and again, India is not doing a lot of genomic sequencing, but to the extent that it is, B.1.1.7 looks to be pretty common and dominant in parts of India, maybe northern parts of India. There are variants that are homegrown or identified first in India that are emerging. We don't know the role that those homegrown people often talk about as a double mutant, but there are a couple of different variants in India. We don't know what role they're playing. I'm confident that B.1.1.7 is playing a substantial role, at least in parts of India where that's more common. So variants, assuming that somehow and acting like the global pandemic was over, relaxation of public health standards, testing, which has been limited, and then slow vaccine rollout. All of that became the sort of perfect storm for finding, and then, by the way, a very, very slow public health response. I would say by late February, early March, it was clear that India was heading in the wrong direction. Case numbers were increasing substantially. By the end of March, it was undeniable that India was on the verge of a catastrophic wave of this infection, and yet we really didn't see much policy action until well into April. The needs right now are both on the public health side, need for more testing capacity, more protection of providers, more masks. And then on the healthcare delivery side, you're seeing stories and those visuals of people basically dying outside of hospitals because hospitals are out of bed. So you need more hospital beds, a lot more oxygen supply. basic therapies. And people I'm talking to on the ground, hospitals are running out of sedation medicines. They're running out of basic things that you need to be able to just keep hospitals going. Even if you have a ventilator, you can't ventilate people unless you can sedate them. There's just some very, very basic things that a hospital needs that Indian hospitals are running out of. And by the way, that's in Delhi and Mumbai, which are the two of the kind of premier cities of India, obviously the capital and the political capital and the financial capital. So that's like basically New York and Washington, D.C. In second tier cities, things are much worse, but we have far less insight into what's happening. And the third area where India really needs help is in vaccinations and raw materials as well as vaccines. So that's basically the list of things that the Biden administration has committed to helping on. You saw that on Sunday, the National Security Advisor, Jake Sullivan, came out with a list of things that the U.S. government was going to do. Yesterday, the U.S. government reported that they were going to create a pathway to getting all of our AstraZeneca vaccines out. I think those are all good steps. I think there's just the need here is enormous. And so the US government is one of the few things, I think few entities outside of the Indian government that can really bring the kinds of resources to bear to get this through. Last point I want to make about India before I shift to talking about where we are in the United States. There is a bit of still in the conversations I'm having with a lot of the senior political and really health leaders in India, still a bit of a mental model that somehow this is a crisis. We're going to get through this in the next few days, maybe over the next week, and then things will start getting better. Things are not going to start getting better in the next week. Some places infection numbers may come down. We are seeing in Maharashtra, where Bombay is, numbers starting to come down. Delhi still looks quite bad. There are large parts of the country, Bengal, Bihar, Uttar Pradesh, where we have a long way to go and things can get much, much worse before they get better. Even if nationally you see infection numbers starting to turn, a lot of people who are going to need hospital care in the days and weeks ahead. So this is basically the next 4 to 6 weeks, I think, are going to be very, very difficult for India. The challenge is, can we do things now that make sure that it's 4 weeks, not 6 or 8, and that we minimize how bad things will get. But in no way is India anywhere near out of the woods. One of the last things I just want to mention, one reason, there are many, many reasons, I think, for America to engage with India. One, it's the right thing to do. It's a major country, lots of people getting sick. Second is that it's a democracy. And I think at this moment, the value of one democracy coming to the aid of another, of allies, there's a whole set of value there. And last but not least is the broader issue that it is a global pandemic. And when large outbreaks happen, they become fuel for more variants, which then always spread globally. And that if we're really going to get past this pandemic, we have to work much more effectively together as countries. So a whole set of reasons why I think it was great to see the Biden administration make the decisions that they did. I want to shift gears a little bit to talk about our country, the United States, where things look actually quite different at this moment. And the contrast is in some ways almost jarring. So America has been seeing a little bit of a mini fourth wave. For those of you who follow me on social media, last night I said, and I think this is right, that we are on the tail end of that fourth wave, that we had a little bump up in infections, but it is now starting to come down. We have broken below 60,000 cases a day for the first time in about a month, but I expect that number to continue to decline. And it's declining in my mind primarily because we have about 43% of the population, 55% of adults, 54% of adults with at least one shot. That's about where you saw things really starting to turn in Israel. When Israel had vaccinated about 45% of its population, you could see the infection numbers really starting to turn. And so I think that's a bit of where the United States is. And I do not expect another surge. I don't expect, we will certainly never, assuming nothing catastrophic happens, we should never get back to another day where we get up to 100,000 infections. But I think actually we're going to stay well below that. And the question for the United States right now at a national level is how quickly and how effectively can we drive those infection numbers down? Again, we're under 60,000. I'd like to see us get to 10,000 or less I mean, obviously, I'd like to see us get to zero, but that's unrealistic. The way we're going to do that is by increasing vaccinations. And if you have not had a chance, you should read a fabulous piece in Stat News today by my colleague Stephanie Friedoff, who kicked us off, on how we should be thinking about the group of Americans who are not yet vaccinated. The 46, 47% of adults who have not yet been vaccinated. They are not hesitant. They're not resistors. In fact, they are a mixed group of individuals with variety of different barriers to getting vaccinated, and we've really got to address that. So I think the only other thing I will say about the United States, again, I think we're in the right track, heading in the right direction, high levels of vaccinations. We've got a bunch of ways to go. I do think that with a really good ground game, a lot of work, we can get to 70, 80% of adults over the next couple of months. Every time we drive that number higher, we're going to see infection numbers continue to come down. None of that means that we will not see outbreaks, and none of it means that it'll be completely uniform across the United States. One of the things that we've seen in this pandemic is that at any given point, different parts of the country are experiencing different things. Right now, 36 states are seeing declining cases. I think that's fabulous, but that necessarily means 14 states are not. And there are about a half a dozen states where those case numbers are rising somewhat quickly and somewhat concerningly. And those states are going to have to deal with that, both through public health measures and through ramping up vaccinations, and especially targeting populations where vaccination numbers may be low. Last point on the kind of the United States, and then I will I'll finish with two more remarks. While I'm very optimistic about where the next few months are going to be, I do think that it's worth paying attention to what happens in the South over the next couple of months. Last year, one of the big lessons of last year was at the end of May into June, we saw a horrible surge of cases, infections, hospitalizations, and deaths across much of the southern United States. And that, I think, was driven in large part by weather and people spending more time indoors. In March, it's pretty easy to spend time outdoors in Phoenix, but it's pretty hard to do it in northern Michigan. By the time you get to June, that flips. And so I remain a little bit worried about what the South and Southwest is going to experience once we get into June. And I'm particularly concerned about the half a dozen or so states where vaccination rates are very, very low. And I'm specifically thinking about Alabama and Georgia, and Arkansas and Mississippi and Louisiana as 5 states where vaccination numbers have been quite low. And that leaves a lot of people vulnerable for a summer surge in those places. So we're not out of the woods, but I think as a nation, we are heading in the right direction. I want to finish off by talking about these 2 stories that I just told and the sharp contrast between them. I live in Massachusetts, and I'm seeing lots of 16 and 17-year-olds getting vaccinated. And on one hand, I think it's great. Everybody should be getting vaccinated, and I love to see it, and it helps keep infection numbers lower. Healthy 16 and 17-year-olds. While in India, you have healthcare workers who have not vaccinated, have no chance of getting vaccinated, elderly people. And of course, this is not about India and America. This is a global issue and a global divide. And the way we are doing things right now, we are heading towards a future where for the next couple of years, we're going to see the US, Europe, a few other countries in reasonably good shape, putting out fires here and there because of outbreaks, and much of the world, a world aflame with high infection rates, horrible destruction. That is not the future I want over the next year or two, and I don't think that's the future any of us want. And so what we need to do now as a global audience, but particularly here in the United States, because we have so much intellectual and financial capacity, is we've got to turn to global vaccinations in a much, much more serious way. Everybody's been talking about this, but I don't think we've had enough action on this. It's actually a far more complicated conversation. So it's not simply an IP issue, but it is also an IP issue. It is about technology transfer, about building up capacity for vaccine development or vaccine production. There's a lot of work to be done. And the Biden administration has signaled that they are interested in this and have talked about this, but I have not seen yet enough action out of the Biden administration on this. And they really do need to move forward and lay out a plan for vaccinating the world, what the role of WHO and COVAX is going to be, but how we're going to use the power of the US government to create a lot more vaccines so we can all put this pandemic behind us. Until that happens, we are going to continue to have these very jarring conversations where I'm describing that in Massachusetts and Rhode Island, things are getting better and we can open up restaurants and 16-year-olds are getting vaccinated, and there's no oxygen in the capital city of Delhi. So that's the moment we find ourselves in. And I guess my last point is only to say, I don't want to keep finding ourselves in this moment, but that's where we're heading if we don't change course.